If you're a man over 60, there's a very good chance that something as simple as the way you drink water is working against your testosterone and your erections. I'm Dr. Camila Vega, urologist, clinician, and someone who's been seeing men like you in clinic for over 15 years. And today, I want to walk you through 3 common hydration mistakes that actually lower testosterone and reduce erectile quality, and give you exact, practical fixes you can start using tomorrow. I've read the labs, I've listened to the stories. Men come to me frustrated after spending money on supplements and therapies, only to find that a few hydration habits were silently sabotaging their hormones. In one quick phrase, hydration is not just about quantity. Timing, temperature, and how you drink matter. Fix those, and you'll build a foundation that makes other treatments more effective. If this video is for you or for someone you care about, hit like and subscribe. I'll put the protocol below so you can follow it day by day. Let me tell you about Don Roberto. He's 68, originally from Mexico, retired, and used to tell me he felt exhausted by noon, hadn't had a reliable morning erection in months, and avoided intimate moments because he was embarrassed. His labs didn't show catastrophic disease, but he did show a pattern I see a lot: low normal testosterone, slightly darker urine, and a routine of drinking mostly when he felt thirsty and gulping ice-cold soda with meals. We didn't start with prescriptions. We started with water. He agreed to try a structured hydration protocol: warm water on waking, sipping slowly, avoiding cold drinks around meals, and spreading fluids evenly through the day. Within 2 to 3 weeks, he reported more energy and clearer thinking. By 4 weeks, he began noticing stronger morning erections. He didn't need a guarantee, and I never promised one, but these shifts happen for many men, and often they're the low-cost, low-risk first step that helps other treatments work better. Now, let's go through the 3 mistakes one by one, why each matters for testosterone and erectile function, and precisely how to fix it. For each mistake, I'll give physiology you can understand, then a practical protocol you can implement. Mistake number 1, you drink only when you're thirsty. What this looks like, you wait until your mouth is dry or you feel parched, and then you drink. Some days that might mean you have only 1 or 2 drinks until evening. For many men over 60, the sensation of thirst is delayed. Your brain doesn't send that alarm as early as it used to. Why this matters? Thirst is a late warning light. By the time you're thirsty, your blood volume has already dropped enough to thicken the blood slightly. Thicker blood increases viscosity. Think of it like honey versus water. The heart has to work harder to push thicker fluid through the pipes.
That matters because erections depend on precise circulation. The penis uses small vascular channels that need adequate, low-resistance blood flow to become rigid. If your blood is thicker, the hydraulic pressure in those channels drops. Less hydraulic pressure makes it harder to achieve and maintain an erection. Chronically reduced blood volume also stresses the hormonal system. Your body perceives a mild stress state and reallocates resources away from reproductive function. That can nudge testosterone downward over time. Exact fix: distributed hydration protocol. Goal: aim for about 2 liters, roughly 67 ounces, of fluid per day as a general target for many men. Adjust up or down with your physician if you have heart or kidney conditions. Rather than gulping at the end of the day, spread intake in measured, consistent events. Here's a clock-based plan you can try. Upon waking, 300 milliliters, about 10 ounces, of warm or room temperature water, not ice. Warm or tepid encourages gentle circulation and digestion and wakes your system without shocking it. Mid-morning, 300 milliliters around mid-morning, roughly 2 to 3 hours after waking. 1 hour before lunch, 300 milliliters. Mid-afternoon, 300 milliliters. 1 hour before dinner, 300 milliliters. 1 hour before bed, a half glass, about 150 milliliters. That schedule totals about 1,650 milliliters. To get nearer the 2-liter target, add 1 additional 300 milliliters between mid-afternoon and before dinner, or after dinner as long as you wait 30 minutes post-meal before drinking more. The key is distribution. Avoid cramming most of your water into 1 or 2 moments. Measuring your intake with a 300 milliliter marked glass or bottle makes this simple and repeatable. Implementation tips: use a marked 300 milliliter bottle or a travel cup with volume markings. Seeing the line makes it easier. Tie drinks to routines. After your morning bathroom break, after brushing your teeth, after a short walk, after a cup of tea, consistent cues help you build the habit. Set 5 modest alarms on your phone for day 1. They'll become reminders you don't need. Watch your urine color. Aim for pale straw to light yellow. Darker color means you should increase intake. Completely clear urine all the time can signal overdrinking, so aim for that light straw color. Mistake number 2, you gulp large volumes too fast. What this looks like, you finish a glass in 2 big swallows, or you chug a large bottle after exercise or between meals. You might think more quickly in equals faster hydration, but that's not how your body handles fluid. Why this matters: rapid drinking floods the stomach and triggers a reflex that sends much of that fluid quickly to the bladder. The kidney hears big incoming volume and increases urine production. You'll feel the urge to go and lose most of that water before cells and blood volume can benefit. In addition, chugging dilutes gastric juice if you drink large amounts right before or during a meal.
Strong gastric acidity is necessary for breaking down proteins and releasing minerals, zinc, magnesium, and certain B vitamins that are critical cofactors for testosterone production and many enzymatic pathways in the body. There's a second effect on circulation. Rapid intake can cause a short-lived imbalance in blood sodium and plasma osmolality, prompting hormonal adjustments that alter fluid distribution. That roller coaster of shifting fluid between compartments is inefficient for improving steady blood volume and for delivering the nutrients your testes need to produce hormones. Exact fix: the conscious sip method. Instead of gulping, practice slow, deliberate sipping with the following routine. Use a 300 milliliter glass as your unit. Take slow sips over 5 to 7 minutes to finish that glass. That's approximately 1 small sip every 20 to 30 seconds. Breathe slowly through your nose while sipping. Nasal breathing supports calmer autonomic tone and improves oxygenation and nitric oxide production in the upper airway, both helpful for circulation. After exercise, rehydrate with small, repeated sips rather than one large chug. If you're sweating heavily, replace electrolytes in addition to water. Plain water alone can sometimes dilute sodium if you drink enormous volumes very fast. If you wake at night thirsty, take a few slow sips rather than gulping a full glass. Micro-implementation tips. Time a 300 milliliter glass on your phone if you need to practice. Set a simple 5-minute timer and sip until it rings. Keep a glass in places where you tend to gulp suddenly, near the TV, on your bedside table, or next to your favorite chair. Having water readily available reduces the impulse to chug when the urge hits. Replace the last gulp reflex, where you empty a bottle because you don't want to leave it half full, with a rule: always finish within 5 to 7 minutes. Mistake number 3. You drink very cold water around meals. What this looks like: regularly drinking ice-cold drinks right before or during meals, or habitually choosing ice with everything. Some people love the sharp sensation of cold, but it has downstream effects. Why this matters: cold liquids cause local vasoconstriction. The blood vessels in the mouth, throat, and upper digestive system narrow slightly in response to cold. That narrowing is not huge, but when it happens repeatedly around every meal, it reduces optimal blood flow for digestion. Efficient digestion depends on good blood supply to the stomach and small intestine, and robust gastric acidity. When those slow down, nutrient breakdown and absorption suffer. Minerals like zinc and magnesium are less available when digestion is impaired. Both are fundamental to testosterone production. Zinc in particular is a well-known player in testicular function and testosterone synthesis. On top of that, if cold drinks blunt effective digestion, you may absorb fewer calories and nutrients and feel hungrier or less satisfied, which can drive poor eating patterns that indirectly harm metabolic health and testosterone levels. Exact fix: room temperature or warm water timing. If you prefer cold drinks, you don't have to give them up entirely. You do need to change when and how you consume them. 1 hour before meals. Drink room temperature or lightly warm water. 300 milliliters is a good guideline. Warm fluids promote gentle blood flow to the digestive tract and prepare your stomach for optimal acidity. 2. During meals, keep sips minimal. Small swallows are okay, but avoid drinking a large glass during the meal. If you must drink, take tiny sips and consider room temperature. 3. After meals, wait 30 minutes before drinking a larger volume. The first 30 minutes are when stomach acid and digestive enzymes are most active breaking down nutrients. Waiting preserves gastric acidity and improves mineral liberation. Cold drinks can be reserved for long exercise sessions, post-exercise cooldown, or as an occasional treat, but try to avoid habitual ice with every meal. Practical alternatives and cultural adaptations. If you enjoy cold beverages as part of your culture, for example, sodas with lunch or iced agua fresca, try this adaptation. Have a small 50 to 100 milliliters cold sip to satisfy taste, while drinking your main glass of tepid water either 1 hour before or 30 minutes after. Small changes like these help preserve the social pleasure of a cold drink while protecting your digestion and nutrient absorption. Putting the 3 rules together, a short summary. 1. Don't wait until you're thirsty. Spread fluids across the day. 2. Sip slowly. Avoid gulping large volumes quickly. 3. Avoid ice-cold fluids around meals. Prefer room temp or warm before, and minimal sips during. Wait 30 minutes after. Confounders, caveats, and when to be cautious. There are important exceptions and medical considerations. Hydration advice is not one size fits all. Medications, loop diuretics, thiazide diuretics, and some blood pressure medications affect fluid balance. If you're on diuretics, your water needs and timing may be different. Discuss any changes with your prescribing physician before dramatically increasing intake. Heart or kidney disease. If you have congestive heart failure or advanced kidney disease, excess fluid can be dangerous. Do not follow a generalized 2 liters per day target without medical clearance. Your cardiologist or nephrologist will give specific limits. Sodium levels and hyponatremia. Rapid, excessive water intake can rarely lower blood sodium in vulnerable people. That risk is highest when enormous volumes are consumed in a short period, so the sip method and distribution over the day protect against that risk. Caffeine and alcohol. Both act as mild diuretics. If you drink coffee or alcohol daily, you may need slightly more water, but don't overcompensate without talking to your clinician. Alcohol also negatively affects sleep and testosterone, so reduce intake where possible. Sleep and stress. Chronic short sleep, less than 6 hours regularly, and persistent high cortisol from stress will blunt testosterone for reasons unrelated to hydration. Hydration helps, but these other lifestyle factors must be addressed in parallel. Diabetes, obesity, and vascular disease. These conditions affect circulation and hormones independently. Hydration is a necessary foundation, but rarely sufficient alone to normalize testosterone if advanced metabolic disease is present. Monitoring and expectations. What to watch for and how quickly you might notice change. I always tell patients to look for simple, objective markers over the first few weeks. What to monitor. Urine color. Pale straw is the target. Dark yellow suggests underhydration. Frequency. Going to the bathroom comfortably every 3 to 4 hours during waking hours is common. Morning erections. Note presence, duration, and firmness. Keep a private log if you find that helpful. Energy and cognitive clarity. Do you feel less foggy mid-morning? Do you have improved stamina for short walks? Mood and motivation. Small improvements in mood often track improved hydration. Timeline to expect. Within 3 to 7 days, you may notice decreased thirst, fewer headaches, and clearer urine color. Within 2 to 3 weeks, increased day-to-day energy, better concentration, and occasional improvements in morning erections for some men. By 4 weeks, a number of men report more consistent changes in erectile quality and libido. Hormonal assays and clinical improvements vary. Many factors contribute to testosterone levels. Hydration is supportive, not a guaranteed cure. If you don't notice improvements, if after 4 to 8 weeks you see no positive change, or if you have worsening symptoms, it's time to evaluate other causes: sleep apnea, medication effects, significant vascular disease, untreated diabetes, or primary testicular dysfunction. These require medical attention and possibly hormonal testing. Hydration helps create the best possible baseline for those investigations, but it is not always the singular solution. Practical daily plan you can start tomorrow. Here's a compact version you can print or save to your phone. It blends the 3 rules into a single daily routine. Morning on waking. 300 milliliters warm or room temperature water. Breathe through your nose while you sip. Mid-morning. 300 milliliters slow sips. 1 hour before lunch. 300 milliliters warm or room temperature water. Mid-afternoon. 300 milliliters slow sips. 1 hour before dinner. 300 milliliters warm or room temperature water. 1 hour before bed. 150 milliliters slow sips. Optional. Add 1 more 300 milliliters during the day if you want to reach around 2 liters. Use the sip method for each drink and avoid ice-cold drinks within 1 hour of starting your meal and for 30 minutes after. Micro habits to make it stick. Keep a 300 milliliter bottle with volume marks. Finish one every 3 to 4 hours. Tie a drinking event to a small action. After your bathroom break, after you take medication, after you stand up from the couch. Practice nasal breathing while sipping for 5 to 7 minutes. If you feel the urge to gulp after exercise, take 5 smaller sips spaced over a few minutes instead of 1 large gulp. A 7-day challenge, specific instructions. I want to invite you to a simple 1-week experiment. This is practical and measurable. No pills, no equipment. Day 0. Get a 300 milliliter cup or mark a bottle. Note your baseline, urine color this morning, whether you had a morning erection, and one sentence about your energy level. Days 1 to 7. Follow the schedule above. Wake class, mid-morning, 1 hour before lunch, mid-afternoon, 1 hour before dinner, half class 1 hour before bed. Use the sip method. Avoid ice-cold drinks 60 minutes before meals and 30 minutes after. Breathe through your nose while sipping. Check urine color twice a day and write it down. Note one change each evening: energy, mood, morning erection, or digestion. On day 8, come back here and tell me in the comments what you observed. Even small wins matter. Your experience may help another man try the same low-cost change. Safety reminder. Before you make sudden or large changes to fluid intake, check with your treating physician if you have heart failure, advanced kidney disease, are on dialysis, or take diuretics or other medications affecting fluid balance. Do not stop or change prescribed medicines without medical supervision. If you experience dizziness, swelling in the legs, or shortness of breath after increasing fluids, contact your clinician promptly. Final thoughts and encouragement. Hydration is not glamorous, but it's foundational. Think of it as the cement that holds a healthy lifestyle together. When the plumbing and the pump are working well, when your blood moves freely, your digestion extracts nutrients, and your sleep and stress are being managed, your body has the resources to maintain better hormonal balance. Small, consistent habits beat giant occasional efforts. The sip you take today is an investment in the next few weeks of your vitality. Let me close by repeating the 3 simple rules so they're clear and memorable. 1. Don't wait until you're thirsty. Spread your water across the day. Aim for about 2 liters as a general target, and use a 300 milliliter glass as your unit. 2. Sip slowly. Finish a 300 milliliter glass in 5 to 7 minutes with nasal breathing. Avoid chugging. 3. Avoid cold drinks around meals. Drink warm or room temperature water 1 hour before meals. Minimal sips during meals, and wait 30 minutes after eating before larger volumes. Do the 7-day challenge. Come back and tell me in the comments what changed for you: energy, urine color, or morning erections. Share this video with a friend or a partner who might benefit.
Your small change could be the first step toward meaningful improvement. Remember, hydration often helps, but it's one piece of a larger puzzle. If you have chronic conditions, are on medication, or have severe symptoms, see your physician for a complete evaluation. I'm Dr. Camila Vega. Thank you for letting me guide you through this. Take that first slow sip now and give your body a chance to respond.